How do drugs target cellular pathways for USMLE Step 1 success? Have you ever wondered how medications work at the cellular level? Understanding how drugs target cellular pathways is essential for success on the United States Medical Licensing Examination, Step 1. Let's break it down in a straightforward way. Drugs interact with specific molecules that play a role in cell signaling. This signaling is vital for regulating many physiological processes in the body. When preparing for the United States Medical Licensing Examination, Step 1, grasping these mechanisms can help you answer questions related to pharmacology effectively. At a basic level, drugs can bind to receptors on the cell surface or inside the cell. These receptors include G-protein-coupled receptors, receptor tyrosine kinases, and ligand-gated ion channels. When a drug binds to a receptor, it can either activate or inhibit signaling pathways inside the cell, leading to changes in cellular responses. One well-known pathway is the cyclic adenosine monophosphate pathway. For instance, hormones like epinephrine attach to beta-adrenergic receptors, which are a type of G-protein-coupled receptor. This binding activates adenylate cyclase, converting adenosine triphosphate to cyclic adenosine monophosphate. Increased cyclic adenosine monophosphate activates protein kinase A, resulting in physiological effects such as an increased heart rate. Conversely, beta blockers inhibit this pathway by blocking beta-adrenergic receptors, which reduces cyclic adenosine monophosphate production and heart rate. Another significant pathway is the phosphatidylinositol pathway, which involves inositol triphosphate and diacylglycerol. When drugs bind to GQ-coupled receptors, they activate phospholipase C. This enzyme cleaves phosphatidylinositol bisphosphate into inositol triphosphate and diacylglycerol. Inositol triphosphate raises intracellular calcium levels, while diacylglycerol activates protein kinase C. Both of these actions lead to various cellular effects. Calcium channel blockers and drugs that affect protein kinase C signaling can modify this pathway. Receptor tyrosine kinases activate the mitogen-activated protein kinase pathway, which involves a series of phosphorylation events. This pathway is crucial for regulating cell growth and differentiation. Drugs like tyrosine kinase inhibitors block receptor tyrosine kinases, halting downstream signaling, which is particularly useful in cancer treatment. Steroid medications work differently. They can cross the cell membrane and bind to receptors inside the cell or in the nucleus. These steroid receptor complexes act as transcription factors, changing gene expression over hours to days. Examples include glucocorticoids and anabolic steroids. Other pathways include the cyclic guanosine monophosphate pathway. Medications like nitrates increase nitric oxide, which stimulates guanylate cyclase to produce cyclic guanosine monophosphate, leading to vasodilation. To excel on the United States Medical Licensing Examination Step 1, students should understand these pathways, the receptors involved, and how drugs modify them. This knowledge is critical for answering questions about drug mechanisms, side effects, and therapeutic uses. Recognizing how medications like beta blockers, calcium channel blockers, steroids, and tyrosine kinase inhibitors influence these signaling pathways is essential for treating various diseases. In summary, drugs target cellular pathways by binding to specific receptors or enzymes, which alters intracellular signaling and cellular functions. Mastery of these concepts is fundamental for the pharmacology and physiology sections of the United States Medical Licensing Examination, Step 1.